Hey, good afternoon, everybody. You guys hear me okay?
Yes.
Probably a little too good, right? It's an intimate setting, so I think we're going to keep it formal, relatively informal at the same time for this hour. So we appreciate y'all joining us, making the time to be here. We are Brothers in Public Health, and today we'll be giving a session on engaging Gen Zs and millennials in public health and careers in public service in general. So we got some formal introductions that we will get out the way, but before we do that, in true millennial Gen Z fashion, we want to show y'all a little video, just gotta know how we come. I'm a brother of public health. Of course I was inspired to pursue this career based on the predatory presence of liquor stores, cash advance places, and fast food joints in black neighborhoods.
I'm a brother in public health. Of course I'm always reading books on the systemic oppression of people of color, so that I can be more grounded in moving forward my work more equitably.
I'm a brother in public health. Of course I want to support other men of color in the field because I know what it's like to walk into a professional room and be the only.
I'm a brother of public health. Of course I stand for all Black, Indigenous, and people of color in spaces where our voices and experiences are underrepresented.
So we are Brothers in Public Health.
Good afternoon, everyone. My name is Alex Bonanno. I use the he series pronouns. I'm from Boston, Massachusetts. I'm the Health Equity and All Policies Manager for the Boston Public Health Commission and the Office of Racial Equity and Community Engagement. And with Brothers in Public Health, I am the chapter lead for the Greater Boston chapter.
Good afternoon, everyone. As you can see in the video and in the image, I used to have locks. No longer have them anymore, but I'm growing them back. My name is Miles Davenport. I live in the DC, Maryland, Virginia area. I currently work for the DC government as an epidemiologist for the Office of Chief Medical Examiner. I'm one of 4 co-founders for Brothers of Public Health. Brother Winston is one, and then we have 2 others, Omari and Aaron. They're not able to be with us today, but we have a couple other members. They'll share a little bit more about their stories in a little bit, but I currently serve as the account executive for Brothers in Public Health.
Thank you. I'm Savion Thompson. I'm from Reedsville, North Carolina. I also use the he, him pronoun series. I am my position outside Brothers in Public Health. I serve as a REACH program coordinator for the Institute for Advanced Learning and Research. So REACH means the Regional Engagement for Advanced Community Health, so help engage people in the rural communities of North Carolina and Virginia. With Brothers in Public Health, I was their first intern, and now I've been, I guess, moved on or promoted, however you want to think about it, as the project coordinator, and I also am the co-founder for the Greater Boston chapter.
And my name is Winston Wellington Wright. Fortunate to be one of the co-founders of Brothers in Public Health, along with Miles. Seems like we've been working on this forever, but maybe about 4 years. Originally from Philadelphia, Pennsylvania, but based out of St. Louis and Nashville, Tennessee. My day-to-day, 9 to 5, I work as a senior consultant for health equity and belonging inclusion for one of the largest healthcare systems in the Midwest, and work as an independent contractor in the city planning space in Nashville. And Miles, I'll take the clicker, bro. Sorry.
You're frozen me for a second.
It's all good. So for those that got to see our little reel, our little TikTok, as well as hear our introductions, just by a show of hands, we wanted to start off by asking a few questions. The first one, how many of you knew a man of color, or another man of color for the brothers in the room, studying public administration or public health when you were a student? Just how many folks? I was hoping to see more, but that just underscores why we're here, right? Okay, next question. How many of you had a mentor or a sponsor, should insert, that looked like you, helped you get to where you are now? Raise your hands. Okay, so some mentorship, some sponsorship there, but not your colleagues, right? So he doesn't take enough credit, but this is actually his brainchild, Miles' brainchild. What I would say is we are all Gen Zs and millennials up here, all started our public health careers in or around the COVID-19 pandemic. So it really seemed like we were these young, successful brothers, just getting our degrees, out here in the world, ready to attack it, save our communities, all these different things, right? At the same time, we knew through our various undergraduate and graduate experiences that lack of representation was something that many of us experienced. I went to Morehouse School of Medicine for a Master of Public Health, so I didn't experience that. But a lot of other brothers in the field do, right? So one of the statistics that we found when we were doing our market analysis, developing this nonprofit because we are official 501c3, was that Black men represent only 3.17% of Master of Public Health graduates, right? So when we think about the studies, when we think about articles that we see, when we think about all of these different things in terms of racial inequities in healthcare, in public health in the United States of America, we know who's overrepresented when it comes to some of those statistics, right? But when it comes to the folks that are doing the work, we kind of are unicorns based on this percentage. Furthermore, in preparation for this conference, because we really, despite some of us having this crossover between public admin and public health, never really thought, about the parallels between the two fields. And so this is a data set from, and I'm going to butcher the name, but it's like Institute of Post-Secondary Analysis for Educational Outcomes, something like that. They produce data every other year about degree, assertion, by race, ethnicity, demographic, all these different things. So you can see our focus is men of color. When you look at, and these are bachelor's degrees, 2023, when you look at the percentages, women are in orange, men are in blue. We have these different racial and ethnic categories up here, and you can see that men of color are vastly underrepresented, both in public admin and in public health as well, right? So our mission was very, very simple. To increase representation of men of color in public health, to advance the field, culture, and awareness in communities of color. And our vision is a world where men of color are positive change agents for the liberation of their communities. Little pie in the sky, but again, we're Gen Zs and millennials up here, right? So the way that we set out to do this, we have 4 strategic objectives, or kind of pillars that we've been continuing to evolve over time. The first is building awareness, right? So how do we leverage the culture that we're a part of, the generation that we're a part of, to engage everyday people and professionals through technology like social media, right? To really create the awareness of what public health is, why it's important for us to understand public health concepts, and how we can leverage this field to really serve our communities. So we build a lot of awareness through social media. If you end up following us, that reel that we showed you on the beginning, we do stuff like that all the time for different kinds of things, mainly to target young people who may not know what graduate degree to pursue, or maybe have never heard of public health. And they can see these 4 guys and say, wow, like they look like me, they're talking like me, and they're doing work about things that I care about, right? The second thing is community impact. So it's great to create social media. That's an easy thing to do, to network with folks. All of us are from different places and had met each other virtually before we met in person. It's actually the first time I'm meeting everybody here in person, but we've been connecting for years. So again, we are a product of our generation. We are a product of the pandemic, Zoom, Microsoft Teams, all these things coming together. So one of the things that we knew we wanted to do was have a local geographic footprint. I'm going to stop speaking a little professional and just say we wanted to show up in the hood in the cities that we're from, right? We are highly accomplished. We've done, the new thing. Our families are proud of us. How do we truly give back and not just do donations or just showing up on the block, every once in a while when we visit grandma, but really having a presence and extending our professional capital in the neighborhoods that we come from, in the zip codes that we come from, so that, again, young men that many of us can relate to can look at us and say, wow, this is something that I can aspire to be. So through community impact, we've been focusing on developing local chapters. We have one in Boston, so our young brothers from Boston are here. We also have one in Atlanta, and we'll be planning on launching 6 additional chapters next year. Another thing that we won't talk about as much today, but research and advocacy is another pillar and strategic objective. One of our co-founders works at the Robert Wood Johnson Foundation, so major philanthropic organization. And we try to do our best to remain as apolitical as we can, but advocate for policies and things that we know are paramount to the protection of public health, definitely during this current time quite frankly, federal administration. And then the last pillar or objective is development. So how do we directly give back to young brothers? We are a mighty team of about maybe ultimately 6 to 8 people. We've been able to, fundraise a little over 20K since we started. But even with that financial capital, we want to be able to give scholarships, mentorship programs, all different kinds of things. So you all will learn a little bit more about some of the offerings we've launched this year as well. So in terms of building awareness, again, I already mentioned we are big on social media and content creation. Some of y'all in the back might not be able to see this, but that reel that we showed at the beginning now has over 250,000 views. So, almost a $250,000 or more than a $250,000. And when we saw the amount of outreach or kind of engagement that people gave to us, it was pretty amazing. So this is a comment on Instagram, somebody who saw that reel. And again, right, this is something that for us as public health professionals, the presence of some of these predatory business in Black and brown neighborhoods, it's like the ABCs, we know that this exists. And even as a student, as a young person, you also may know this exists, right? How do you talk about it, right? What's the language about it? What degree would I pursue? What career path would I pursue if I wanted to do something about this? So it's really cool to be able to see people again, see us kind of in our natural environment on social media and make those connections. Additionally, one of the first ways that we started to outreach other brothers in other cities, we're all from different places, again, work at different institutions, went to different schools, was through focus groups. So we post a flyer on LinkedIn, hey, we're hosting a focus group on Zoom. We'd love for y'all to join us and talk about your challenges navigating your graduate program, maybe some of the challenges you've had as an early professional, and what more do you need as an aspiring public health professional. This guy in the middle, his name is Omar Richmond. He has a really big platform called the Public Health Millennial Podcast. He actually interviewed Miles and I during COVID, and that's how we all started to meet. He had this podcast, bringing other young professionals in public health on. A few of us were brothers, and so we were like, oh, wow, this is pretty cool. We should start something.
Yeah, so I know I spoke about it earlier as being the co-founder for the Greater Boston chapter. We really want to get back to why we want to do that. I think you saw the picture of him earlier. Darwin is also one of the co-founders for the Greater Boston chapter. So when we started thinking about what we're doing in the public health field, we always talk about meeting the community where they are and going out to where they are. And I know I was in high school back when COVID hit, so that was something to see, especially as a senior and then entering college during that phase. It was impactful. And it was something that definitely changed a lot of how I viewed the field and made relationships with people and how some of my lasting relationships have been impacted because of that pandemic. But as we start to look about how we can kind of expand our presence past the online platform, we started about thinking about how we could do chapters in person. And so one area that we thought about was Boston. I was in Boston, so I graduated from Northeastern University with an undergraduate and my master's degree from there. So when we started to think about that, and we had met Darwin, some things that we really thought about was, why do we want to do it? And something that we noticed, both of us being a student, me at Northeastern and him at Tufts University, was the lack of representation within the field, and especially among our peers. With our peers, I think, I'll speak for myself, in my master's program, there were 4 men of color in general. When I was intentional to meet them all, we developed a healthy relationship with each of them, but that was something that was extremely impactful and important to me to kind of develop and make my own community there. And then when I think about the professors that I had, there were 2 men of color I actually had. This is not just my master's program, this is my entire time, undergrad and graduate degree at Northeastern. And so that was something that was also really important to us. And when I started to understand that this is something that's happened to me at Northeastern, I am sure this is happening everywhere else as well. Boston is a school, when you look at Boston proper, I think there's 40 plus colleges, and then when you think about the greater Boston area, there's over 100 universities in that area. And so if this is something that I'm feeling, this is something else that we should be addressing elsewhere as well. And then so we also understood that, meaning that Boston is a healthcare hub, we have a lot of universities and a lot of really good institutions for healthcare, but just because you have a lot of really good institutions, there are just that many students applying for those exact jobs. And so there also is a feel, or maybe like a lack of understanding for belonging for people who are professionals as well. So young professionals, older professionals, all just feeling like they belong in that space. So that was another reason that we want to do it. And so I'll turn it over to Alex. He can talk more about some of the locations, especially about what Boston looks like.
Awesome, thank you so much, Davion. So as Davion mentioned, he was the co-founder, along with Darwin. I ended up coming in a little over a year now to become the chapter lead for the Greater Boston chapter. As a Boston, born and raised native from Roxbury, if there's anyone who's familiar with Roxbury. Woo! One of the things that I wanted to make sure that I brought to the team in regards to being the Greater Boston chapter lead was making sure that we were fulfilling that mission of increasing visibility within Boston, but then also making sure that we were addressing the racial health inequities that we were seeing in the city. So, as I mentioned earlier, I work for the Boston Public Health Commission, and we just recently released our Health of Boston reports, which shows that there's a 23-year life expectancy gap between residents who reside in Back Bay, one of the more affluent residential areas, and Roxbury, where I'm from, which is Boston's predominantly black neighborhood. 2.3 miles away from each other, 23-year difference in life expectancy. And so that's unacceptable. And really just recharges like why we need to be doing the work that we currently do. And so I tackled that work through my job, but then I also wanted to make sure through Brothers in Public Health that we were being intentional around increasing that awareness, around building that community, around building our visibility by doing in-person events where I felt like, well, where we all felt like it really mattered. So for example, on this slide, you'll see our first event, or our second event was at Nubian Markets. So Nubian Markets is a new food market that opened up in Roxbury, so we wanted to make sure that we had, for our first like real convening in the city of Boston, because we did do one in Cambridge, but I feel like Cambridge and Boston, two different areas. So for our first one in Boston, we wanted to make sure that we did it in Roxbury to, again, build that awareness, bring people together, bring other young professionals together in order to make sure that we can collaborate with one another on how we can help to make sure that we are still serving the same constituents through our program. So we had that as our first in-person event in Boston. As you can see on the slide here, there's a picture of me and Darwin, who was a co-founder. We also wanted to make sure that we were upholding the Brothers in Public Health mission around advocacy work. So here in that photo, you'll see us at the State Senate House. We actually were helping to promote awareness of the Health Equity Compact bill through the Health Equity Compact. And so we wanted to make sure that we were able to do that as well. So of course, the in-person convenings and making sure that we're getting to network with one another, but also not missing that point of we need to be using our voice and using our platform that has fortunately been gaining a lot of traction since we first started as an organization to really make sure that we're promoting health equity bills and health equity policies. Next slide, please. And so another thing that we wanted to make sure that we were continuing to do as the first chapter, first regional chapter for Brothers in Public Health, is that we wanted to make sure that we had a set cadence, because if you don't have a set cadence, then engagement can fall off a little bit. So we wanted to make sure that at least one event per quarter that we had, and we wanted to make sure that we were addressing different public health issues as well. So our next in-person event was around our Cuts and Conversations, which was a conversation and dialogue around mental health. So we actually brought a black man who is also a psychologist who's in the local area to come and to speak, and then we hosted the event at a barbershop, because we know that some black men in particular, or just men of color in particular, the traditional psychological settings, psychiatry settings is not always the best way to engage, and they may not feel the most comfortable there. So we wanted to make sure, again, also doing this in Roxbury, where most black men are, where most men of color live and reside, and making it T accessible. T's are public transportation, making it T accessible so that folks can get there. So again, wanted to make sure that we're being intentional about what we're doing, how we're doing it, who we're engaging. We made sure that we even canvassed around to make sure that if there were people who were walking by, to also come in and make sure that they got resources. So we had a resource table with different men's health resources, those around like chronic disease, prostate cancer, suicide, awareness, hotlines, etc. So we had that dialogue piece, and we also made sure that we had, the actual haircuts. If we were doing it in the barbershops, we also wanted to provide that incentive for men to come and receive a haircut, because when you feel good, when you look good, you feel good, and we wanted to make sure, again, that we were really addressing and getting to the root of how we can be engaging men into taking advantage of the public health services that are in the city of Boston, because like we mentioned, there's a 23-year life difference and life expectancy difference, even though Boston is such a resource-rich city. We have so many medical institutions, we have so many educational institutions, and yet we're still seeing the outcomes that I just mentioned around that life expectancy difference. And when we look at that data even more, Black men, unfortunately, are at the bottom of that. They have the least, they have the worst health outcomes, unfortunately, when we're looking at the drivers for premature mortality in the city of Boston. So moving on from that event, we also made sure that we wanted to have an event around recovery services. Opioid overdose is unfortunately another issue that is really plaguing the city of Boston. We have seen a decrease in around 30% from last year to this year, so that's been great. But in this photo, you'll see that we partnered with AHOPE, which is a harm reduction organization in the city of Boston, to bring folks together to help pack their reduction kits and also to learn more about the services that they provide as well. So I hope through these examples, like, we really get to see the work that we're trying to do to really make sure that we are building something substantial. Yes, the viral posts are important, that interpersonal connection online is definitely important, but it's not the end all be all. So, and we know that, and that's why we wanted to make sure that we were really driving this home in regards to creating these regional chapters so that we can have more of those in-person events to help substantiate what we've already been doing on a national level. I think I'll pass it to Miles.
Oh, all right, very good already. All right. Question for the audience. Who in here likes money? Let's be real, let's be honest. Who in here likes money? Everyone's hand should be raised. Let's not be shy. This is a real thing. Money's not always bad. Way before we gave birth to the nonprofit, offering a scholarship has always been on the back of my mind, our mind. We know that one of the greatest ways that we can empower brothers who are currently pursuing public health or even aspiring to pursue public health is by giving back in the form of scholarship, which is one of our values in brothers in public health. So I think these are some of probably the obvious reasons why scholarships are offered in general. So I won't read through these. Next slide. And so we're really excited that we were able to officially offer our first scholarship this year. We've been incorporated since 2003. We've been in talks way longer before that, maybe 2 or 3 years before that. We were finally able to offer our first $1,000 scholarship to Mr. Charles Udezi. We're really happy for that. We look forward to providing more scholarships in the future. But like I said, we understand, we know that the best way to empower folks while they're pursuing public health is through scholarship. And this is one of the greatest ways that we can encourage Gen Z, millennials to keep at it, keep at the fight. So this year, just gonna share some info for those who might be interested in joining our nonprofit as a member. This year, the scholarship was available to non-members. Next year, we will be making it a little bit more exclusive to members only, but we plan to offer more scholarships starting next year. But just wanted to shout out Mr. Charles, who's dually enrolled at Johns Hopkins, doing 2 different master's programs, so there it is.
And I would just add, in addition to y'all being able to hear from Alex, being able to see someone like Charles, I said we're unicorns, but we're also out here, right? Like, they're also out here. There's brothers, young brothers our age, now younger than us, crazy to say that, same young, who are doing the damn thing, excuse my French. And so for Charles to be able to be from Stockton, I've never been there, but I hear some things about Stockton. So for him to be able to be there, make it all the way to Johns Hopkins, to be able to do his thing, and for us to be able to support him, right, as a nonprofit, we're just getting our start. That was kind of like a wow moment. And I know, we're centered a lot at the graduate and undergraduate level now. It's the easiest entry point to capture young brothers, quite frankly. A lot of people always ask us, what are you all doing for the high schoolers and, people who are going in? How are you, enhancing the pipeline? That definitely, as we grow and as we get big, is the aspiration, but we gotta start with where we can. So again, Charles is an example of just young people leveraging technology. He'd been following us on Instagram and LinkedIn forever, applied to the scholarship, and it was really tough because a lot of brothers had excellent applications and a lot of the same dreams, so it was a hard selection. But even Alex is an example, right? Incredible young brother, only 30, works for the Boston Health Commission, brought so much political capital into the local chapter because he's there, right? And so it's just a big deal when we see this and we see that we're able actually to have this. So it's just one of the offerings that we're trying to scale. Again, only 20K in the coffers, so we started with 1K, something small, but the idea and the hope is that we can continue to grow and can continue to give more. And I'll talk about this a little bit more later, but definitely in a time where all of this is being attacked, right? Just trying to advance and enhance our communities, big institutions and organizations, the formal places, some of our jobs are reducing, these kind of offerings because of our federal administration. When we first started, people would ask us, what are you all doing about this anti-DEI stuff? We are the solution. We don't even need to hashtag brand ourselves as DEI. We know who we're here for. We know what we're trying to support. And again, this is just an example of that.
So once again, can I get another show of hands how many people had mentors here? I know a lot of people you said that kind of helped you along the way. Okay, so I wasn't thinking about doing the activity, but I'm thinking we should do one now. So if y'all could just like turn to each other for like a minute or two, or just talk about what that mentorship looked like for you, and then we're gonna share after. Like if you didn't have a mentor, what you wish you had, and if you did have a mentor, what was the most beneficial to you?
Especially my field is
How we feeling on time? Y'all need another minute? Okay, yeah.
put it where it goes for children talk about mentorship and we have a mentor and he said it's been right about his mentor because he's been running from college and all of that. I didn't know and I was telling you when I got
so why should I do something? She's like, oh, she's telling me to do something for this. Okay, I'm like, what is this about? She's like, this. Okay. And what am I doing? And then I usually got to work where I said, I'm working in the background. And then,
somebody had an accident. Mentor. mentorship, or like what they were talking about, that mentors and everything that look like that.
So people say,
Yeah.
oh, yes. So everyone's like, oh, this is such a blessing. So that's great. A great street you're on. I was like, yep.
Actually, I was
my parents, I think, prefer that you want a lot of opportunity. Have opportunity. We're doing college pharmacy,
Okay, how's that? Y'all still need another minute? Y'all good?
I was trying to back down.
Okay, gotcha. Okay. So is there, so just like, if anyone wants to just shout out, what was some things that you kind of noticed or that you shared between with mentorship that you all had? You want to shout anything out? I got good ears. I'll hear you.
We got similarities with both our bosses as well.
Oh, both staff bosses? Okay.
I've read that your mentors, that people who are mentors sometimes find themselves within 15% of the same income bracket as their mentor. I had the benefit of meeting a wonderful person here who's had some great mentors in her life, and because of her relationship, she already knew her value, but she garnered the courage to ask and sometimes demand the value that she's worth.
Rightfully so. Rightfully so.
By her own witness and her own experience, I see that this principle of being birds together, fly together, having a mentor that is in high space economically, that you can too become one that's within a 15% income bracket than the person that is mentoring.
That is great. That is great. And you that just underscores how important having mentors are, not just peers that are like you, just having someone that's also above you in those roles. Anyone else want to share? I'm not going to push past nobody that want to share.
You get to be the solution. So if you don't have a mentor, you get to now be a mentor that you didn't have, right? You get to be the change you want to see.
That is it. Yeah. That is so true. That is true. Can we give up a round of applause for that one? That is so true. I think that was something that we understood as Brothers of Public Health. We started to think about what we really want to do besides getting into the field. We really want to make sure that we can connect each other with mentors so that we could elevate ourselves in those roles. And so I want to leave with some questions by the end to just kind of like ask yourself. But when we start to think about Brothers in Public Health, and something that was really important to me was developing that mentorship program. And so when I was developing this program, I asked myself two questions. The first were, what was something that I really valued and enjoyed about being Brothers in Public Health's first intern? And so something that I thought a lot about was the mentorship, the collaboration, the cohesiveness as a group, especially as someone that is Gen Z. That mentorship piece was taken away from me. Especially, I feel like I developed a lot of relationships when you are when you're like a senior in high school, you start to get some of those people who are going to help you in that next way. I'm also a first generation college student, so it means a lot to be able to kind of have someone know the ropes in front of me to kind of give me that guidance and that stuff forward. And I'm very fortunate to have Brothers in Public Health kind of guide me on that way. And when I entered public health, I kind of stumbled into it. I actually did not think I was going to this field at all, no rhyme or reason. But I knew I wanted to help people, and I worked at a hospital in Boston. It was a very good hospital, I will say. I'm not going to say the one, don't want to be shady. But I didn't like the way that they were treating patients. The doctors were fine, but the administration was not. They worked with me. I worked in oncology, so if patients need service and they have cancer, I believe you should be able to treat them regardless. It shouldn't be, oh, they don't have the right insurance, or, oh no, the PA can't do it because we don't get a return on investment. I didn't like that. So I was very happy to get out of that space and into public health. And so that was something that I thought was really important to me, to kind of have them help guide me. And they were, and I will say, they're all in different spaces. No shade to Winston because he's in administration, but they're all in different spaces. And so they can kind of guide me and lead me to which way that I wanted to go. And then the second question that I wanted to think about when I was developing this program was, as a student, what did I most need while I was a student? Or what do I need now as a public health professional? And so when I was taking those questions into account, I kind of put those into 4 different kind of contexts. So the social context, cultural, environmental, and temporal context and experiences. And so the first one being the competencies, and they were all centered around belonging, because I think we really did see how there is a lack of belonging within our field. I mean, by show of hands, how many of you just feel like the first day when you walked in, you feel like you belong in your workplace? Good for you, shout out to you. I have some great people to work with. They hire. No, let me stop. I just started my job. Let me stop. I love my job. I love my job. But yeah, we can talk about it. Anyway, but yeah, it's also something else that I really did want to understand and kind of get that connection to people with, because that was something that I think a lot of people could gain a lot of value from. And so having a mentor that isn't just, that's also like you in your field, but also someone who is above you that can kind of help guide you in those ways. And so I do also push the mentors to kind of think, what are you doing to give someone else a seat at the table? Now that you're at the top, are you kind of bringing someone along with you? Are you being the solution that you want to see in the world? Or are you kind of creating that space for someone else to kind of get where you are, or showing them what they should do, what they shouldn't do? And then also asking yourself, how am I showing up at work? You know, so are you showing up as yourself? Because I will say, being Gen Z, I feel like we are very authentically ourselves. I believe that when we're told you can be anything when you're little, we're going to be whatever we want to be when we grow up. So, and then sometimes I think, especially earlier, there are some places where you're not allowed to be who you are. So even when I think I was interviewing for this job, I remember, I'll never forget, it was my first in-person interview. I was, like I said, it was COVID. We were all doing everything on Zoom. I will never forget, I got in the car and I touched my ear and I had my earrings and I almost threw a fit. All because I thought, I was like, that is so unprofessional of me. These people are going to look differently on me. And didn't even think about how the interview went. I just thought about the earrings and I was like, I'm getting this job. I very fortunately did get the job. So it was nothing to do with the earrings, but that just goes to show that sometimes you need that guidance and another step to kind of understand those things. So I did want to develop this mentorship program, and then I wanted to make sure that it was, yes ma'am.
I just had a question about something you said earlier on when you were at the hospital, and you said
Yes.
you knew that, you know, you weren't with the administration and how they were doing, right?
Yes, ma'am.
Was there anything that they could have done differently that would have made you stay? Or, you know, how did you navigate through that? What could they have done to help you?
I honestly think the reason why it was my cooperative education experience, so it was something that was required, so I was gonna ride it out for 6 months regardless. But I think something that I would have really appreciated more was just kind of, they brought me in at the beginning to kind of ask me what I wanted to do. And so I was very transparent. I was like, oh, I want to do what you do. You were like the program director. And so I told them that, and I think they took it more as a threat instead of like, oh, let me mentor you. It was kind of more as a threat. I'm not sure why. I didn't necessarily want their spot today or tomorrow. I knew I'm very understanding of having to build my way up, build my way up the ropes and understanding that way. So I think if they had been more transparent of like how the process would have worked, what they have done. I don't think I met with them. I think I met with them twice, at the beginning, at the end of my experience. But other than that, I never met with them again.
Okay.
I never heard from them.
Because I'm just thinking about, you talk about belonging and like, right, different generations. I came to this so I could kind of understand Gen Z, because you know, I work in HR.
Mm-hmm.
So, you know, I want to kind of understand your perspective and what will keep you in the workplace, if it's something, you know, because
This might be interesting for HR.
Please take your microphone.
Oh, use microphone.
Yes, please.
Okay.
okay.
I think from older generations, what we need, number one, is for y'all to keep it real. I think that, you know, we have so much access to information, right? Just because of the internet at this point, right? So disparities, inequities, knowledge around that history, knowledge around how some of our own institutions may be perpetuating those inequities, even if it's in our mission statement that we're supposed to be addressing them. We're these young, hungry people. We want to be able to have an impact on society. So when we meet a seasoned executive or leader that has 20, 30 years on us, they look like us sometimes. Sometimes they do. And they don't know how to foster that energy. They do not know how to foster that curiosity. they give us the very soft light piano, corporate canned answer about some of the things we're looking for. It pushes us away. Immediately it's like, oh, this isn't the space. There's a lot more to say regarding what I just said, but the first thing is just to keep it real. And I think another thing that Savion mentioned I think is really important, because there's a distinction. 3 of us millennials, he's a Gen Zer. But what we're all running in, we're all young millennials as well, 30, 31. What we're all running into is the very real reality that many people think we're a threat, or that we're coming for their employment. And in this job market, we get it. But at the same time, it's like, no, we just want to contribute and feel fulfilled, feel like we're giving back. And we got to take development serious, like develop us. And I will also say, for me, many ways that we develop, well, we get developed through each other. I mean, we met Savion as an undergrad, applying to our first internship program. And I wasn't able to be on his interview, but when I saw his recording, I was like, yep, he's the guy. Because we saw the competency, we saw the potential, we saw immediately how he presented. And if there aren't people that look like him or that can speak to the things that he wants to do, it's going to be us, even though I'm the bad guy in health administration. So,
Thank you. Thank you for that.
Yes, sir. Oh, yeah, go ahead. Alex, then we'll direct your question.
And I think another thing, so before I actually got into public health, I was also an educator. So I taught Gen Z, I taught high schoolers. And I think one of the things that, through that experience for me, that really resonated is it's not enough to tell the younger generation how or what to do. They need to understand the why. Why is it important? Why does it matter to them? I have an English teacher just popped into my head that I used to, she always used to write on my papers, so what? So you're writing this, you're doing this, X, Y, Z, so what? Why does it matter? What's the point? And I feel like that sometimes through these interpersonal connections with older generations, I feel like that piece is missing. It's like, don't question me, do what I'm telling you to do, and that's all that you really need to know. But I think from that experience of being in the classroom and like seeing my students, I always just like, why is this applicable to me? And I feel like that is a key component that's missing from those conversations in collaboration, right? Not collaboration, in combination with, the development piece and the lack of desire to develop younger folks. It's also in the threatening. I do feel like that also definitely is in the workplace, but I think that so what piece and the why I feel like is really crucial, and I feel like it can help mitigate those experiences if supervisors or just older generations in general would just think and to pause and to think about, okay, so what is the why behind this? Because again, it really isn't enough to just say, do this is how you do it. We need to know the why.
I have something. I'm to HR and other entities as well, but I don't want to even ask this question as in HR, but in general, being a Black person, because I'm doing somewhat of a project, but can't tell everybody about it, but it's with the 5 generations in the workforce. We all have something in common. We're Black. And I have a younger son, younger than you guys. So it's not like we're so much different, because we all experienced working in a workplace that it was only us. We asked that same questions that you guys asked. When we were little, we all said, why mom, why dad? So it's not like we're that different, but we're really more alike than we are different. It's just in different stages that we're in lifing for everybody in a different pace and way. And if we can collaborate instead of trying to bang heads, but collaborate together. You offer something, your generation, my son's generation offers something, I offer something, someone's older than me and older than me. We all offer something at the table, and I think if we can just respect that, I think we'll be in a better place, because my mother's no longer here, but her 80-year-old self was more technical than some of these younger people. So it's not like it's always the technical side, because I was like, what? How do you know to do that? What? You 80, it's like, how do you know this? But I just see a lot of potential in where we're at. Unity is very powerful. And if we can break this, what society want to say with generation, because all those stereotypes are not true about the generations. but we have more in common than we have different in our generations. And if we can just respect each other's walls with dignity and respect, I think we can be greater and stronger. Am I missing it?
No, I
mean,
think that's very true. I
instead
get
of putting walls up, take the walls down, get to know each other, because we all are sensitive in our generations. And I think the older generation, I'm part of the old, but not old. But I'm part of the old generation, and I'm like in between y'all, the two walls. But I'm just saying, I come from a large family of 9, and we all have unique personalities. I have brothers that's 10 years older than myself. You know, it's just if we quit trying to stereotype and kind of like look, because everybody is different in those generations, but we all come across prejudice, discrimination. We all felt unloved, not worthy. We all had great ideas, and we get shut down. I think the older generation got shut down from a different ethnicity, more so than the generation get shut down from. And sometimes the older generations are being protective, and they probably have tougher skin than the newer generation. Because the way that they were talked to, the other races talked to, that was our wall. What we're doing now, I'm looking at the walls of generations in our own unified culture. If we break down the walls and just see us for who we are, what we bring to the table, and try to collaborate instead of being siloed, I think we'll be greater and stronger. And the older generation, like I see in politics, they do sometimes see the younger generation as an inferior, and I think because they don't understand, they want to show, I think they want the newer generation to give them a little bit more respect, because the shoulders that they had to go through for other senators and congresswomen and men to be there. But I just think we just need to collaborate a little bit more and talk together instead of talk at each other.
That is so true. I think you hit the nail on the head. It reminds me, when you said all those things about breaking down the walls between generations, remind me of a book I was reading. I got into books over the summer, but I'm not sure. I think that's because I was done with classes. I was like, man, to keep reading, I keep learning. But I was reading a book called Upstream, and they were talking about a school in Chicago about how their graduation rates were so bad. And so each teacher kind of took it as like their personal problem, like, oh, this is my problem. These students aren't graduating, this is my problem. But maybe it wasn't their problem, but they all took it personal. And so one thing they really did was implement, I think it was freshmen, they implemented freshmen and the best teachers together. And so if someone was more experienced or may not have, like you said, your 80-year-old mother, maybe they didn't have a degree. My grandma's 84, and she knows things I don't even know. And I'm like, I went to school, it don't mean nothing. Educated, got nothing on their experience. So I will say it does make a huge difference just putting some of your best against some people who are in new spaces, because I think that's when they're the most vulnerable. I will say our generation does go to work because we get paid, but we stay for the mission. So I think if your mission is impactful and important to what you are doing and what they're doing and developing, I think that will really make a huge impact on how we stay. Yes, sir.
I wanted to make a comment about Mr. Philadelphia. I don't remember your
No
first
worries,
name.
Winston. You can call me Philly though.
Winston, right? Wilson, right?
Winston Wellington, right?
Yeah.
I wanted to make a comment about your keep it real. The generations have to have an understanding of, you know, your generation has to have an understanding of the generation before them, right? And vice versa, right? Because it's different. The workforce is different, the way you get into it is different. And when you're talking about keep it real, from your generation to the older generations, you have to understand that people that look like us, they couldn't be themselves in these offices, in these buildings, right? When you're talking about keeping it real, you have to understand from their perspective that they can only be real at home, right? They have to be a different person in the office, right? And so in order to stay gainfully employed, you have to be a different person when you walk into that office than you are at home, right? So keep it real. They can tell you what's going on in this office building. They can tell you how, you know, things go. But again, they have to be one person here and another person at home. For your generation, it's a little different, right? Everyone knows that, you know, you guys come in, you're gonna ask for a certain salary, you're not gonna accept the job if it's not that salary, right? But generations before, I have a family, I have to feed them, I have to accept certain things, you know, at this point, because I have to take care of these people at home, right? So I understand to keep it real, but they're gonna tell you, hey man, when I came in here, this is the way I had to do it, right? And I can try to help the next guy behind me, but if you're not doing it the way these people want you to do it, guess what? They're gonna show you the door. You can keep it real all you want, you'll be unemployed. Not the same thing now, right? But years ago, that's the way it was.
Yeah.
But also, I'm saying the same thing, I'm doing this big project, but I'm saying the same thing. When you don't have any kids and you're single, you can keep it real. Until you get them kids and then get their wife or their husband and children, then you have to shift and pivot of what life is and bring it to you.
Those are absolute choices.
And I'll provide some clarity as well, because I think this is a fantastic conversation. It's exactly actually where we want to go. We want to have these conversations. Keeping it real is not, we code switch. There is even this conversation within the millennials, between Gen Z, right? So when I say keep it real, it's keep it real based on what your job description says and what you're here to do. So you notice how Savion said he was on an oncology floor in a hospital. If I have a leader that I'm aspiring to, you're another black man, you're the vice president of this floor, keeping it real is not normalizing Black death. Keeping it real is holding our nurses accountable when they clearly show biases and it's impacting the patient outcomes that we have. Keeping it real is having enough courage to talk to your counterpart, which is another vice president, and ask them about why they are maintaining this policy that is penalizing folks from North St. Louis, which is a predominantly Black neighborhood, and they gotta catch 2 or 3 buses to get to the hospital, but we still haven't changed the policy, but yet your colleague is the VP of HR and has the power to do that. I fully understand, being educated Black men, all that stuff, Morehouse, we definitely gotta wear masks. There are things that I think Gen Zers need to learn a lot about, and I'm only a few years older than them, quite frankly. But in terms of, and again, in alignment with Savion's point, it's the mission. And there's just so much information now. We know everyone is not gonna be, Angela Davis or MLK in their respective roles. We understand that. We also understand you gotta be smart about how you use your capital in an organization. But when we have the opportunity to stand up for our people and actually address inequities, we have to do it. And I can talk to you afterwards about just my own personal journey and how I struggled to find people that I felt were up to speed. And I think, unfortunately, a lot of this is in direct parallel to the political situation we have right now. The keeping it real is less about the identity and how we show up. It really is more about what we're actually trying to do for folks. And I think, without getting too much into it, a lot of young people, capitalism is a dirty word for some of them, right? Obviously, we all know that makes our world go round. But when we start to look at how that impacts our communities, keeping it real is more so to addressing that and doing what, I think that you are doing based on your job description. But I definitely feel you.
So if that VP, right, that you went to, if they acknowledged, said, okay, I see you, I see the issue, I'm gonna go over here, I'm gonna talk to Jimmy, and whatever. And gonna do their part to acknowledge, I see it, let you know I see it. But the organization as a whole decided they're gonna still go and proceed forward with it. Now for me, from my perspective, the way I always operate is, I'm gonna speak up, right? I'm gonna say something, and but I understand the big umbrella of that we got to make the money and whatever. I'm gonna speak up, I'm gonna say something. But if that boss or that organization is not in alignment with my personal mission, which is, I guess, is where we're coming in common, right? Then I gotta make a decision. Am I gonna stay here and say, okay, I'm gonna go along to get along, or is it time for me to keep it moving? So that's, I think we were saying the same thing, it's just a different perspective, right?
And my VP, he was like, told me, you go have that conversation with such and such. And I was like,
yeah.
no, but I was an administrative fellow at the time, so it's a fancy position in certain hospitals, so I actually could do it. And this was right during the summer of George Floyd, 2020. Actually got a skip level meeting with the CEO of the health system.
Okay.
And he was like, you're really bold and courageous. You should be the health equity guy for all of XYZ health system. That's my title now.
Awesome.
So it worked for me. I was courageous, I was willing, but I was depressed for 6 months into my job because I was talking to executive directors that were like, health disparities, I don't know what you're talking about. Black people in St. Louis, they're just like that because they want to be like that. And I was like, what? And so I really struggled with adjusting to that. And obviously the political nuances of where you are makes a big deal about what you can talk about at work as well, matter of fact.
Thank y'all for that.
This is good. We gotta move on because we're probably pretty fast, so yeah.
Yeah, no, this is a great conversation, but I'll let Miles go ahead and give us our closing.
For the interest of time, thank you all for the lovely discussion. We can continue this after. We feel like all are able to stick around. We did have a prompt that we wanted to read out, but I don't know if we have time for that. These are good times. Thank you all. I think before you all dismiss, Mr. D would like to come up and give some brief remarks.
Thank you very much for the Mr. Young Man. Be your granddad. Hello everyone, my name is Thei, theist without the ST. I am a part of public health, and I am a proud member and volunteer with NFPBA. Would you give your finger snaps or a hand clap to Mr. Bano? He is receiving gifts from us, Mr. Winston Wellington Rice. That name's longer than mine. Mr. Miles, not Davis. And gentleman, Tate Savion. So that's what I wanted to do, just present them with these gifts. Thank you, gentlemen, for bringing this content to Texas and giving us something exciting to talk about and to take home. Have a good one.
Thank you all for coming out. If you would like to check out our content or follow us, please scan our QR code. That'll take you to our link tree where you can access our different social medias.
Inspiring, young brothers, young women in your life. Please share our stuff with them because we would love to get some stuff started here in Austin and just Texas in general as well.
I'm gonna follow y'all, I'm sure.
We sure appreciate it. My sister graduated from 18 last year. Right here, y'all wait for great conversation.
Oh no, it's HR over here, so I was like, I gotta get to the meeting. Welcome to Major Stack.
I'ma pay y'all.
You was one-to-one. I can't be mad at it. I'm a serious business, so I no. See, the thing is, our defense was stuck on the week, and then our offense was the next week, and then last week was like, our defense was okay, but we're doing major, and the offense, I said in our stadium, we got big teams, like, now we're on big teams, it's so great. Yeah, but we're like class stuff so bad right now. Like I would not. I'm thinking right now in college. I watch this is our first time. Like Arch Manning, everybody just thinks he's gonna be that guy. The Manning. I would think it's maybe something changed. I don't know what changed, but it's not. The Boston State was not really pretty. Like, they don't see like a, you know, like this was the national championship competition. They not
Yes, yes. I appreciate that. That was helpful. Thank you. Jimmy talking sports.
Absolutely. I appreciate y'all for coming on. No problem.
Mr. Wellington, sir.
Stay y'all. Nice working.
All right.
Y'all have a good one.
Unless you're on TikTok, right? We're black and